So today we're going to be talking about neurofibromatosis type 1 versus neurofibromatosis type 2. And even though they sound the same, they're both neurofibromatosis, they really don't have anything to do with each other because they're on different chromosomes. The only thing they share is the neurofibroma. Otherwise, there's vast differences between these two conditions, and they present to neuro-ophthalmologists in different ways. So we'll do the one that is a lot easier first, which is neurofibromatosis type 2. Type 2 is characterized by bilateral vestibular schwannomas, so acoustic neuroma. And so those tumors usually come to ENT because they have hearing loss. But because the lesion is in the cerebellopontine angle or could produce hydrocephalus, it might come to us as papilledema or non-localizing increased intracranial pressure-related sixth nerve palsy or a compressive sixth with diplopia. If you have a unilateral vestibular schwannoma, then you have to have something extra, either a first-degree relative that's affected, or you have to have multiple meningiomas or multiple schwannomas, or you can have the molecular confirmation for the neurofibromatosis 2 mutation, and that is on chromosome 22 on the long arm Q12. So we have molecular confirmation for neurofibromatosis type 1 and type 2 mutations, and the characteristic feature is the bilateral vestibular schwannoma. If it's unilateral, you need a family history. In addition, the NF type 2 has ocular findings that are useful, which is the posterior subcapsular cataract, and patients with NF2 sometimes have retinal hamartomas or epiretinal membrane, but the posterior subcapsular cataract is the thing really that is the distinguishing feature. In contrast to NF1, NF2 has meningiomas and schwannomas. So the optic nerve tumor in NF2 is optic nerve sheath meningioma, not optic nerve glioma. In NF1, it's not a bilateral vestibular schwannoma. It is not chromosome 22. It does not have the PSC, and it does not have the meningioma. Instead, what it has is optic nerve glioma, and that glioma can be in the chiasm or the optic tract or anywhere in the hypothalamic chiasmal pathway, rather than meningioma. We're going to have cutaneous lesions, and I told you the neurofibroma is in both, but the plexiform type of neurofibroma is almost pathognomonic of NF type 1. The skin findings in NF1 include axillary and inguinal freckling and flat brown macules, which are called café au lait spots. And they're called that because they look like coffee with milk, so it's a brownish flat macule. And depending on whether you're prepubertal or postpubertal, the number and the size matter, and you have to look that up later to determine the actual criteria on size. And then the other thing that we have to think about in neurofibromatosis type 1 patients is agenesis of the sphenoid wing, which can cause pulsatile proptosis, agenesis of the sphenoid wing. And the chromosome is not 22, it is 17, and it's on the long arm again, 11.2. So different chromosome, glioma not meningioma, skin lesions, freckling, axillary, inguinal, café au lait spots, agenesis of the sphenoid wing versus bilateral vestibular schwannoma, chromosome 22, meningioma and PSC in NF type 2.